Several towns in Massachusetts are now critical risk zones for a serious mosquito-borne illness.
I don't know if I wouldn't go out. I'd probably just wear long pants and long sleeves.
Communities across the U.S. state are trying to prevent the spread of eastern equine encephalitis after a rare case was reported in a man in his 80s.
Headache, a fever, but because of the inflammation of the brain, you can have a decreased level of consciousness and seizures.
Infectious disease specialists say it can be dangerous and deadly.
It's a pretty catastrophic infection. It can cause a very, very severe syndrome of encephalitis, which means inflammation of the brain, and it carries a rather high mortality rate.
Officials in Massachusetts are spraying widely, some towns closing parks and fields and urging residents to avoid outdoor activities during peak mosquito hours from dusk until dawn.
Please don't do this to our kids.
800 people signed a petition.
Health Canada says the last reported human case of the disease in this country was in 2016. But health officials in the city of Ottawa say a horse there recently tested positive. So they're encouraging residents to use insect repellent, wear light-colored long pants and long sleeves, make sure windows and doors have screens, and remove or empty standing water sites around your home. The virus has no cure or vaccine for humans, but Canadians shouldn't panic, says this expert.
Outbreaks of this particular disease in the United States and in New England, it's usually only very small handfuls of cases.
Canada's public health agency monitors mosquito-borne diseases, but it says unlike West Nile virus, human cases of eastern equine encephalitis don't have to be reported to the agency, and there's no formal surveillance system in place. Alison Northcott, CBC News, Montreal.